I'm Shannon Weber with Hive, a hub of positive sexual and reproductive health, and I'm here with...
So I'm Justin Arnold. I'm a physician assistant at Whitman Walker Health in DC.
Yeah, so we're here in Washington, D.C. It's May 2015, and Whitman Walker Clinic, just to give quick background, is a federally qualified health center, and you guys see about half people living with HIV and half people not living with HIV. And I wanted to talk with you about PrEP, because you guys were one of the first places to implement PrEP when it was approved in 2012. And now I understand you're the highest volume provider of PrEP here at Whitman Walker. How many patients do you see?
So at last tally, I have 85 patients on PrEP.
That's a lot.
It is, yeah. So I see a lot of patients each day that are coming in for PrEP.
And where are people coming from? How do they find out about PrEP?
I think the majority of my patients have heard about PrEP from friends and peers, and less so from providers of the medical establishment, but the majority have all heard about it from friends.
So some kind of community level word of mouth. And what was challenging for you when you first started screening people or offering people PrEP?
At first, it was a little difficult to decide who needs to be on PrEP, but then I realized that actually patients probably aren't telling me their real sex practices, and some are, and some certainly have very high-risk behavior, but I realized that there are a lot of things that are influencing people's ability to talk about truthfully what they're really doing outside, and so because of that, I have been more often telling people the risks, the benefits of PrEP, and telling them the CDC guidelines about who they think should be on PrEP, and leaving it up to the patient to decide what their risk is. And I think patients are pretty good about knowing what they do, and once you inform them the risks of different sex acts, and deciding themselves.
Figuring out what works for them.
Yeah.
And so what surprised you in interviewing all these people now about PrEP?
The biggest surprise was about how much sex people have. I think people have a lot more time than I thought to have a lot of sex and a lot of different sexual partners.
I love that you're so open that people share this with you too. That really says something about you as a provider.
Yeah, I think a lot of people do open up, but I'm very cognizant that some people still aren't ready to tell people what they really do behind closed doors and how frequently they do it, and I think that's important for providers to recognize. To
just be aware of upfront.
Yeah.
What other advice would you have for a provider who might be thinking that they want to integrate PrEP into their clinical practice?
So the easiest way to learn about PrEP is to read the CDC protocol. It's very clear, it's very straightforward, it's not that long, and it tells you exactly what to do. And then also learning how to have conversations with patients about what PrEP is, what the risks, the benefits are, and leaving it up to them. That would be my biggest advice.
It sounds like it got easier for you over time in some ways too.
Yeah, absolutely. As you felt more comfortable talking about different sex acts and the risks and benefits of PrEP, and certainly it becomes a little bit easier, just as any sort of clinical management is. You just see more patients, you just get more comfortable with that specific topic.
I had a provider tell me, you know, in the beginning those conversations feel a lot longer than they actually are. And the more you do it, it's actually not that long.
Yeah.
And it doesn't feel that long.
As with any clinical skill,
So I'm always interested in stories about trans women and women being offered PrEP. Do you have any experience with that here in your practice?
Yeah, so we have a lot of Hispanic or Spanish-speaking trans women that we provide care to, and I think that many of them aren't unfortunately familiar with PrEP, but after explaining it to them, many of them are eager to begin the medication because they recognize that they are at risk. And I can't say, I don't know the extent of what is putting them at risk, but I think that it has a lot to do with maybe the power dynamics and possibly being here illegally and not being financially secure, that they're put in situations that probably aren't the safest.
Thank you for all the good work you do. This is exciting to be able to come and learn from you.
Yeah, it's great having you here.